if the impulsivity stops, then you have to deal with your feelings. And with her, without movement, without talking, without doing, she could just be and feel sadness.
Yeah. And she had a lot to be sad about.
Welcome to the A Different Kind of Psychiatry podcast, brought to you by the ACO. I'm Dr. Chris Burritt. Each month, we feature a patient interview, case presentation, or interview or discussion with one or more of our doctors who practice a different kind of psychiatry. We are interested in your questions and comments, and I would love to hear your feedback. Send an email to aco@orgonomy.org. The best way to help the American College of Orgonomy spread its knowledge is by letting others know about us. If you enjoy the podcast, we'd appreciate you leaving a rating and review. If you're interested in attending one of our webinar presentations, you can meet the doctors and join in on the discussion afterwards. If you're interested in training with the ACO, you can learn more about the medical orgone therapy or social orgonomy training programs. You can connect with us and learn more at orgonomy.org. This episode features a discussion with Dr. Susan Marcel about ADHD. We both discuss patient vignettes to give two medical orgonomists' perspective on the treatment of patients with ADHD symptoms. So Dr. Marcel, thank you very much for sitting down with me today and talking about a timely topic, ADHD.
Good to be here.
So I just want to read some titles of articles I saw, and this is just the last 6 months, and this is just the Wall Street Journal. Opinion: the military needs recruits with ADHD. The condition can be a disability in some roles, but it can be a superability in others. Opinion: the meaning and overdiagnosis of ADHD. More scrutiny is needed. Opinion: ADHD is real, and we know how to treat it. Properly prescribed, Ritalin can be a life-changing medication. Learning to focus without medication. People with ADHD often rely on stimulants like Adderall, but behavioral techniques can be just as effective in dealing with distraction. Students struggle academically, fight amid Adderall shortage. Children who haven't had access to the medications are experiencing problems ranging from getting suspended from school to having trouble sleeping. Opinion: have mental health prescriptions gone too far? Students discuss the various forms of medication used to treat anxiety, depression, and ADHD. What's behind the Adderall shortage? And then there's another article from Barry Weiss's The Free Press, America's Love Affair with Adderall. So those are just a handful of titles of articles in the news in the last 6 months, and there's many, 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 many more. It's everywhere. And just before we get into the conversation, I'd just like to let the audience know here, this is from the American Psychiatric Association. What is ADHD? Attention Deficit Hyperactivity Disorder is one of the most common mental disorders affecting children. Symptoms of ADHD include inattention, not being able to focus, hyperactivity, excessive movement that is not fit to the setting, and impulsivity, hasty acts that occur in the movement without thought. ADHD is considered a chronic and debilitating disorder and is known to impact the individual in many aspects of their life, including academic and professional achievements, interpersonal relationships, and daily functioning. An estimated 8.4% of children and 2.5% of adults have ADHD. It's primarily broken up into inattentive type, hyperactive type, and then there's a combined type. So Dr. Marcel, I have more patients than ever calling up saying, I need an evaluation, I think I have ADHD, or I just moved in the area and I need to make sure I get my medication for my ADHD. I'm curious, what are you seeing? What are you hearing? What's your perspective?
Yeah, having the same experience during the pandemic and now post-pandemic, lots of phone calls for people specifically asking for ADHD evaluations. This Friday, a couple days ago, I received a phone call from a young man who was calling to say, I'm calling because I need Adderall. It was very direct, and I can't get it, and I'm moving to the city, and so I'm seeing a lot of requests for it, and it's also, as you point out, it's in the news, it's in the headlines. Our school systems, some of our local school systems, I mean, the kids line up for their medication midday. They're on Ritalin, they're on Adderall, and I think because it's seen as a wonder drug, or that, and it does. These medicines do help people focus. And my wonder is, what about what's going on underneath? Aspirin works, Tylenol works, but what's going on underneath to cause the pain, I guess, is one of the metaphors that I use with some of my patients. So I've gotten a lot of calls, and my current patients that are seeing me, say, for depression or anxiety, they read one of these headlines and then they say, I think I have ADHD. Can you medicate that? And so, it's definitely in our culture. And one of the things I read, as we were getting ready to do this discussion, was 3/4 of the people who have a diagnosis of ADHD have another psychiatric diagnosis that often goes missed. So that's concerning to me. 3/4, that's a lot of people who may not need stimulants and may be able to get off those meds and treat the underlying problem.
Yeah. I want to read. So in thinking about this talk, I reread an article from the Journal of Ergonomy by Dr. Peter Christ.
No, sure.
This article is from 1995. It's called Impulsivity and the Bioenergetic Relationship to ADHD. It's from the journal, volume 29, number 2. I just want to read part of the introduction, just a quote for just one paragraph. ADHD is currently receiving widespread attention from psychiatrists, neurologists, psychologists, and educators, parents, and the general public. Millions of dollars have been spent on research. The popular press has seen numerous books and articles, including several magazine stories in recent years. Yet with all that has been written and scientifically presented, the debate continues as to the cause and most effective treatment of ADHD. Is ADHD a psychological or physical disorder? Are these children sick or just especially lively, normal youngsters? Is the problem inherent in the children, or is it the result of a faulty upbringing, and particularly the parents' failure to discipline them? Does the diagnosis of ADHD even represent a true disease entity? Among the numerous observations and opinions, however, it is generally accepted that impulsivity is one of the key problems in those given the label ADHD. And so what stands out so much about this particular paragraph from Dr. Christ's introduction is two things. First, it's like we've gone almost 30 years and we still have the same questions. There's still so much confusion about what we call ADHD. And the other thing is, he's highlighting impulsivity, and he gives this wonderful discussion about a treatment of a young boy that he calls Jay. And it's a wonderful article I think listeners should read. It's available on our website. But he says it's generally accepted that impulsivity is one of the key problems. One thing that I've noticed, and I trained in child psychiatry, a fellowship after general psychiatry, that was the classic, I'll put in quotes, a classic ADHD patient was a young boy in grade school who was very hyperactive, couldn't stay in his seat, was blurting out answers, and was just, that quote of driven, as if driven by a motor, just on the go. These days, and especially right now, especially post-pandemic, it seems like a lot of the focus is on the young adult, the adolescent who's distracted, who's out of it, who can't focus, much more than the hyperactive. And not that the young kids who are hyperactive don't exist, or that's still not something that we're dealing with as mental health professionals. But in my mind, that's where there's this huge surge of new patients who are asking about ADHD, unfocused adolescents and young adults. And that really stands out to me. I mean, most of these articles I read are talking about young adults. Mm-hmm. They're not talking about young grade school children.
And I see that. I see that the college, high school, and college age students who call or who are currently treating, that they really are struggling with paying attention, doing well in school, getting the grades, the competition, being able to not be so impulsive. And the medicines do help them. They get these medicines. They share them with their friends, And yet, I think Dr. Chris' point, what is this? What do we know? What don't we know about this underlying illness? And there's something energetically going on within that little boy or that teenager or that college student that, the medicine changes something, but what about what's going on underneath? Again, to my point earlier, they have something else usually going on with them. And my experience has been nobody's really asking that question or looking at that. And that, children and teenagers, college students, they get 15-minute med checks and then they're given a prescription or they answer a questionnaire, and you could get it online, actually, doing telemedicine.
Yeah, I've actually had patients who, on social media, there's people share little quizzes, these little quizzes that you wonder where they come from, but it's like, do you have this? Do you have this? You should,
right.
Consider that.
Right.
Right.
Yeah, it's cookbook medicine, which, I have a problem with that. And, both of us are osteopathic physicians. We're both trained in medical orgone therapy. I think you and I share that idea of we both look at a patient much more three-dimensionally, holistically, energetically, like get at the root cause, not just that it's not mechanical. Yes, there are brain receptors but it's not just about dopamine, in the prefrontal cortex or something. That there really is something deeper down going on that I think deserves our curiosity. And
Marcel, what are you seeing with your patients? I'm curious.
Oh, well, I have a couple of patients. One very dramatic is a young college student who I treated a couple of years ago. This is before the pandemic. And she came to me on a stimulant, and it worked. But when it wore off, she felt like she fell off a cliff. Mm-hmm. And she was almost incapacitated. And, I try to address sleep and diet and exercise, nutrition, supplements, and emotions, like what's going on underneath. She was having a lot of trouble with her boyfriend at the time. But one time she got up early and she exercised very vigorously for an hour, literally running on a treadmill at full speed for 1 hour.
Wow.
And then she forgot to take her medicine that day. She went to work and she realized that she was on all day. She was focused. And she came in like a week or two later and said, I'm running. And, and she would try an experiment, days that she maybe didn't run, she'd take the medicine or not take the medicine. And she saw this pattern that being able to get out whatever she was experiencing through the frustration of her day by literally pounding and running on a treadmill at 6 a.m. She would run from 6 o'clock to 7 o'clock every morning. And she felt wonderful. Like she had discovered it and all by herself, and she didn't want to be on medicine. Like that was distasteful to her. She didn't want to, if she got married and had kids, and would the medicine have an effect on her child, and, is it genetic, and is there something wrong with me? It just stirred up so much, but her feeling like she could do something that changed her functioning really lifted her mood. And I suspect she had a mild depressive component to her presentation, but the exercise just kind of cured her. And so she was energetically getting something out through her muscles is the way we understood it.
Yeah. Dr. Marcel, that example reminds me of just even rereading Dr. Christ's article, his discussion later in the article about the sympathetic versus the parasympathetic nervous system. And there's so much focus, I think, when we talk about ADHD and the scientific community about, like you're saying, the prefrontal cortex and brain functioning, and miss the almost the elephant in the room, which is the sympathetic and parasympathetic nervous systems. And he highlights in that article the kind of lack of balance between sympathetic and parasympathetic. And with this patient you're describing, I mean, she is activating her sympathetic nervous system in this vigorous running that may help with her overexcited parasympathetic responses.
I exactly. Dr. Chris' point is very well taken with this patient, and she did love, very well. She actually left treatment with me. She's like, I don't need to see you anymore. And good for her that she found what worked for her. And she's last I knew, she was medication free and feeling a lot more hopeful that she had some tools that she could use. The idea of popping a pill all the time bothered her. So that actually, when I worked with her, that's when I started really considering maybe there's so much more to training an ADHD patient, because I was trained, the DSM-3 for DSM-5 classic symptoms and the psychopharmacologic approach, not really a psychological or the energetic approach, and how they function. But that clearly she understood something about the balance. She needed that stimulation every morning, and that corrected the sympathetic parasympathetic balance, because she felt this calm focus all day after she did it. So
wonderful.
Yeah. So that's one vignette that really got me thinking about this balance, the parasympathetic sympathetic balance.
Yeah. If I could just also point out, when we say ADHD, we're talking about a list of symptoms which we categorize as a syndrome, a list of symptoms that tend to come together. And that's what I think allows us to be so helpful to patients, is looking beyond a list of symptoms. And so we use someone's emotional character as the basis of our treatment, not that we ignore symptoms. So with this young woman, I mean, that's what stands out is having some sense of her emotional character. And you said she kind of, can have a depressive quality to her. Mm-hmm. And it sounded like she was managing that depressive quality and her energy metabolism and her emotional regulation, and that helped deal with those specific symptoms that came up. And it reminds me of an example of a young man that I met who is different, it sounds like, characterologically, but he did mention that his primary doctor had prescribed him Adderall, and he specifically mentioned it helped with his drive. And that's something that I think gets overlooked when we talk about distraction and focus. There is a quality of these medicines that produce a drive, an external drive, and he felt an internal drive missing, and he appreciated that benefit to him. So he had trouble focusing and staying on task with things, and he lacked a drive. And that's kind of classic depression. Cognitive symptoms are a classic symptom of depression. And it makes you wonder how many patients are having what we'll call ADHD symptoms. Like you said, if they're having other diagnoses, other things going on, if 75% of them have depression, if their depression is not being treated, we're only touching the superficial aspects with their focus.
Yeah, exactly. Well said. I mean, think about it. Like, if you've got a fractured ankle, and this is a metaphor I use with some of my patients, okay, you're going to need a cast for a while, but your body can heal itself if it's set right, and, you use your crutches or whatever. So, okay, something's broken, and can it heal on its own? Sure it can. And then you take the cast off, and then you go to rehab, and you walk again, and you get rid of the crutches. And so I offer that metaphor sometimes to patients. It's like, there's more to this than the fractured ankle. Like, how did you fall? What happened? What were you, and how does your body heal? I'm not against using these medicines, but the rapidity with kids get put on them, teenagers get put on them. But literally, one of my patients is in a school district about an hour from me, and she volunteers at the school. And at lunchtime, there's 45 kids in line at the nurse's office lining up for their midday dose of ADHD medicine.
Oh, wow.
She said to me, there's something wrong with that. And then she knew that intuitively. She's just a mom, and she cares about kids. And what does that say about how we're treating young people? And do we know where that's going to go when they're young adults and middle age and then seniors? If this is a developmental, functioning, energetic problem, how can we address the underlying emotional manifestations? And with this young woman that I was working with, she was so relieved to know she could do something about it. I think there was like an underlying helplessness to her, thinking she could take a pill. And once she knew she had a tool that she had power over, that gave her this mastery, this sense of agency, as they say, she could do something about it and not be the victim of her. She often wondered if this was genetic, because she thought one of her siblings was also kind of spacey. And there is some evidence, there are some genetics to this, but genes are bidirectional. So, if you have a gene, doesn't mean you're going to get the illness, because genes...
It's not your fate.
Right. But I think a lot of people walk around thinking, oh my gosh, I've got this gene, so I'm going to end up with this problem. Maybe not. Can you turn a gene off? And so that, I think, gives patients much more hope and maybe willing to look at other treatments other than just a pill.
Well, I think you're also touching on there's a moralistic quality to mental health diagnoses. And, someone can say, look at all these kids lining up for medicine. Oh, that's a problem. It wasn't that way when I was a kid. And kind of have a moralistic tone to it. Like, what's wrong with what's going on? And there is something wrong. There's emotional difficulties that we need to address, but it's not like a judgment on someone if they take medicine or don't take medicine or
Right.
have symptoms of ADHD. And I think that kind of, it can become a moralistic thing. Everything gets confused, if we're not talking about an individual person and what's going on with their life and what emotionally needs to be addressed.
Mm-hmm. Mm-hmm.
What other situations have you come across?
Yeah, I have a woman that I'm currently treating now. She's in her late 58, 59 years old. She's been diagnosed with ADHD for 15 years. And she sees a very reputable psychopharmacologist who, knows his medicine, very well respected. And she was put on Adderall. She's been on Ritalin, Adderall, and Lexapro too. She was also on that for a little while. And she would also take Vivarin over the counter, which is caffeine. And it helped. And, she got symptom relief. But she came to me, I guess, the end of last year. And her chief complaint to me was, I need somebody to talk to. I need someone to listen. And that caught my ear. And then later in that first meeting with her, she said, I want someone to take care of me. And she had never said that to anybody, to the doctor that was treating her. She would go in for the 15-minute med checks, get the prescription, and off she would go. And it did help her, but she was not happy. There was underlying concerns that she had, things from her childhood. She realized that when she would go on her phone with social media, she would be more impulsive and feel like she needed more medicine. So she stopped social media. She said, I felt every time I would go on there, I felt like a loser. And then she would get anxious about it and then, get more impulsive. And she had a habit of interrupting her family members. Like at dinner, they'd all be sitting around and somebody would talk, she'd just blurt right in, and she couldn't hold back on what she was saying. I mean, she literally needed someone to listen to her, and the family wasn't listening. Like, oh, Mom, stop, So I've been seeing her like once, twice a week for about 6 months now, and she's off of her medicine now. She made this decision, like she wanted to see what would happen, and I encouraged her to consider doing that. And what came up was all this sadness about her childhood. She had a very hard childhood, and I tell you, she's kind of a miracle that she made it through as intact as she was. And I said to her, you're sensitive, but you're not fragile. You got through some very difficult things through your childhood and your young adult life, and yet here you are. She's happily married, got a couple kids, she has a job, and the medicine, the last medicine she was on was the Adderall. It helped the inattentiveness and that inner restlessness she would get, because what she really wanted underneath was she just needed somebody to listen to her. Because when she was a kid, nobody listened. Everybody was talking at her, a lot of excitation, but no perception. So she didn't have that emotional contact. And our hours of therapy, she would have more and more of that experience of what it was like to have somebody really listen to what was going on. And little by little, the impulsivity went away, and we were able to I taught her about the concept of Dr. Christ's famous line, observe, observe, observe. And it just see, when you blurt something out, what's the effect you have at everybody at the dinner table? And she realized that she was part of the dynamic or problem, and she was able to hold it back a little more, only because we had talked about it and kind of rehearsed it in the sessions.
Mm-hmm.
And so she was able to have more genuine contact with her family, with me, and with her coworkers. And it was really lovely to see this woman, in her late 50s, like blooming, just kind of coming into her own.
Yeah.
She believed herself to have this problem of ADHD for 15 years. The medicine did help, but it would wear off, but it never addressed the underlying problem, which she just needed somebody to listen to her.
Yeah.
That what she needed and wanted, she was very hungry for that emotional contact. And that's helped their marriage, and she's developed a better ability to see the effects, like what effect do you want to have on someone else? I often ask her that, what effect do you want to have? And she would stop and like pause, which is very new to her because she's always learning. It's hard. And for her to pause, she would just start laughing and take a big deep breath because she'd hold her breath all the time. So, I had her lay on the treatment couch and we just let her breathe. And one time she did it, she just burst into tears for no reason. She's like, I don't know why I'm crying. Like, it's okay.
But she allowed herself to connect with her feelings.
And she cried and she got up and she felt a lot better and called me later that day saying what a great day she had. So, and she's off medicine now. So,
and that's like the dynamic that in Dr. Christ's article, he points out with this boy, Jay, the impulsivity was a defense of feelings.
Correct.
Meaning if the impulsivity stops, then you have to deal with your feelings. And with her, without movement, without talking, without doing, she could just be and feel sadness.
Yes. Yeah. And she had a lot to be sad about, and we're still working that through.
Yeah.
And I say, you'll get to it. You've been through a lot. You'll get to it. Take your time. Just go home and enjoy dinner with your family tonight. Just break it down, because she goes off into the sunset like, oh, the rest of my life, I've got to fix everything. No, you don't. Just do tonight. Make dinner. And so she's much more satisfied. Had she stayed on the medicine indefinitely, I would have been concerned for her marriage and her relationship with her kids too, and some of her friends. Some of her friends are kind of stiff-arming her and kind of pushing her away, and now they're not doing that as much. I think because of her impulsive speaking and interrupting all the time, it pushed people away, which added to her loneliness, which she really wanted. She said in the first session when she first sat down, "We need somebody to listen. We need somebody."
And Dr. Marcel, I think you would agree with me that if someone takes medicine, Adderall or Ritalin or whatever, and they feel better and they feel content, that's fine. If they use behavioral techniques to manage their inattention and organization, that's fine. But if someone has a sense that there's more to it and they want to go beyond just the symptoms, it's important that they know there are options, and medical orgone therapy is one of them.
Exactly.
And I can think of numerous examples. I have a patient who I see, he graduated college and he's a young adult, and he kind of calls for an appointment every now and then when he kind of runs into a rut or has some kind of trouble. And recently he called for an appointment because literally his friend shared a quiz from social media and said, "Hey, I think you may have ADHD." And that prompted him to come in for his latest appointment. And we were talking about it, and he was saying some of the symptoms that I was aware of just from, because we've been working on and off for years. I knew he had this quality, and he had some sense of thinking things through, like really going through all the details of understanding a situation. He's the antithesis of impulsivity. He's going to think things through. And in our discussion, that came to the surface of him being absolutely clear, like, I need to think through something before I act, before I do, before I make a move. And just asking the question, what happens if you don't? He paused and thought for a moment and said, I'll be afraid. And that was it. I had a sense that was there, but it never came out in just that way. But for him to be clear of, wow, I'm afraid of doing something, of making a decision, of acting. And it was manifesting as symptoms of ADHD, of being attentive and not being able to focus on something, getting away from him needing to act, make a decision. And so in some ways that quiz was helpful in him being aware by, coming to me and us looking at it together. But is it ADHD? Do those symptoms, do we stop at the symptoms, or do we go a little bit deeper? And that was very helpful for him. And it was kind of amazing because then I saw him a month later for a check-in. And this is a guy who hasn't been in a relationship for some time. He's like, I have a girlfriend. And it's like, oh my God. It's like this, he was in touch with his fears. And we haven't gotten into every little detail, but I have no doubt that there's a connection with him being in touch with his fears and developing a relationship. And it's so wonderful.
That's great.
Yeah. But there's so many examples, I'm sure, that you and I both have of, the symptoms of ADHD are just the tip of the iceberg. And a week later, a young woman called me up and said, I need to be evaluated for ADHD. I graduated from college a year ago. I'm kind of struggling to get my first job. I have a job, but I want to start a career. And she came in and kind of described this mild, long-term distractibility, kind of losing focus, but being a very hard worker, an excellent student. Distraction really wasn't interfering with her life in a major way throughout her life, but there was these symptoms that were bothering her. And it turns out that she'd just lost a grandparent on both sides of her family, was struggling with grief, and had this strong part of her that just could not connect with sadness. Just being sad and allowing herself to cry really brought up these feelings of weakness that really uncomfortable for her. And she would just deal with it by I don't want to think about it. I don't want to think about it. And that is a very powerful, I don't want to think about it, because it not only allowed her to not think about her grief, but it took a lot of other things with it. And so that, kind of zoning out from something that has a charge, an emotional charge, had this collateral damage of her just kind of being a little bit spacey here. Not that she couldn't focus and do some work, but would just distract her. And even then hearing, her name was Sam, you don't have ADHD. You're dealing with grief and your sadness, and we can work on that together. But even that then caused her to have a strong reaction of, well, if this isn't ADHD, then this is me. And it's like, oh my God, like there's something in me that I have to face. And there was a little bit of, I think, moralism and self-criticism mixed in that. But the truth is, yes, there was a part of her that is having difficulty dealing with her feelings. And that is inherent to her. That's inside of her. But it's also, part of her wonderful qualities that become twisted. It's not a judgment on her. It's not a moralistic thing. It's just something inside of her that she needs to face and deal with.
And she could tolerate that with your help. Yeah.
I was just thinking, when I mentioned this young woman who's dealing with grief of her grandparents passing, it reminded me of the article, "The America's Love Affair with Adderall" by Maya Solkin in the Free Press. She has wonderful vignettes of students and young adults in it, but there was two examples of young people who recognize the difficulty of the medicines, stimulants that are used to treat ADHD and the effect that they had on their emotional lives. And one even realized the lack of emotional capacity to mourn when her grandmother died. And it makes me think, the young woman who came to me, if she had just kind of been quickly prescribed medicine, I'm having trouble focusing. Okay, take this. This will help. how much in the wrong direction she would end up. Because some of the medicines do have that effect. And so if we're talking about dealing with the underlying emotional problem and they take a medicine that cuts them off from that, that can be a problem, which makes me think of another example, actually, of a young man who came to me, also a very controlled, detailed, diligent young man, in his first job after graduating, came to me already on medicine, and he had moved from his college town and came here and wanted continued treatment, and had some sense beyond trouble focusing that there are things going on, but had a hard time kind of having a sense of exactly what it was, and wanted some of my help with that. And what came out was, so he was on Adderall. The way we actually discovered it was through the Adderall shortage. So he couldn't get that medicine. So we had to use a different one for the time being. And the wonderful effect of that shortage and changing medicines was that it didn't work as well, both in terms of how well it helped him focus, but also what effect it had on him being connected with his feelings. So essentially, he was a very controlled person who had very intense feelings and was constantly on guard of letting his intense feelings see the light of day, whether that's an interaction with someone or even to himself, of really him seeing, like, I have a really strong feeling about this. It could be anger and frustration. It could be fear. It could be sadness. It could be joy. Literally, it was all feelings. The intensity of it was tremendous. And there was a big part of him that could become overwhelmed with that. And yet by changing medicines, it helped him get through the day and he could function, but it was a little bit less than the Adderall. And that helped him be clear about what was actually going on. And we decided to leave it that way, even when the medicine was available, because it was enough for him to not be overwhelmed, but enough for him to be in touch and for us to work through it, of what feelings were there. And again, medicines are not good or bad, but for him, for instance, he may have needed it, at least at first, whenever he started it, before we even met. But the question of okay, well, what actually is going on and how do we address that? That may have been even harder to even get to, because the medicine kind of kept him so even keel. Yeah.
Right. Yeah. And he had you to walk through that with him. He had to do it by himself. So, I mean, that's the power of psychotherapy, good therapy, where there's really good emotional contact between a patient and a doctor, that somebody else gets it. And that's what my patient was. She just wanted someone to listen. This gentleman that you're talking about, he needed someone to maybe just try something different and be aware. He sounded like he was very insightful, and have the courage to look at it together with somebody who got him and understood. So, can't get that in a pill.
No.
Again, it's like the Tylenol works, but what's the underlying problem that's causing the pain?
Yeah.
And some people, I have some patients that then they don't want to look, they don't want to go deeper. Your patient wanted to maybe let some of that come more into his awareness, to his credit. And I think long-term, what effect that might have on your patient's life, where will he be 10 years from now if he does that deeper work, has that relationship with you in a psychotherapy relationship? That's a profoundly different direction than just taking a pill every single day for the next 10 years. So that's another way I tend to look at it. And patients get that.
And even just practically, when there's a shortage or medicine runs out, you can weather the storm a little bit better.
Correct. Well, it allows them to tap into whatever other traits and characteristics they have to cope with things. I mean, life is hard. Life is very difficult, and how we cope with it, who we ask for help, how we take care of ourselves. I think it's a, and I tell patients this, it's a true act of courage to walk into a psychotherapist's office and ask for help.
Yeah.
Base oneself. And I have a lot of respect for my patients that are willing to do that work. Like your gentleman that you're talking about. And that's why we went into medicine. Do no harm. Let's try to help patients to be their best self, I guess.
Yeah, there's just so much about it. And, when I think of Dr. Christ's article from 1995, if there's one thing I think the public needs to hear is that when it comes to ADHD, people are not a list of symptoms.
Correct.
They have an emotional character that when they're ready to address can have such profound effect.
Yes. I actually think it could save someone's life. That I've had patients that have become suicidal because, the medicines just don't do what they need to do, because deep down there's other deeper anger, deeper sadness, or a sense of just being so distraught that they cannot think of anything else other than killing themselves.
Yeah. And actually, some of these articles with the shortages of medicine have talked about some of the tragedies of divorces and loss of job because someone didn't have the medicine and really their functioning completely deteriorated. And there are a lot of tragedies.
Yep.
Yeah. Anything else, Dr. Marcel, you'd like to say?
I really appreciate the work you're doing and being able to have this discussion, because I think it's very timely. And I think we probably need to write an article for the journal to update Dr. Christ's article.
Yeah, I think we have a lot to say. And what I just think about is the examples of the patients you gave and I gave. I think fundamentally they're all very different people, and yet they can have some of the same symptoms and on the very surface look similar, but it's not a homogeneous group of people. And how their therapy is with you, their therapy would be with me, can be greatly different. And so if that's the case, just lumping people together by groups of symptoms, how does that even affect the way we're looking at ourselves, each other in terms of our emotional health? And just to have a picture of, okay, this is a person who has these symptoms and has these struggles and these qualities, that alone, I think, can go a long way.
Like my patient said, I just want someone to listen to me.
Yeah.
They really want that connection. And I think it's a wonderful journey to be with some of these patients to see how their life grows and changes, and their kids grow up and they go on to get married, and it's humbling. So I really appreciate the work you're doing and being able to get this topic out there, because I'm sure we'll hear more. And I'd love to hear anyone who's listening. I'd love to hear their feedback.
Well, that would be wonderful. Thank you very much for your time, Dr. Marcel.
Thank you, Dr. Burritt. I appreciate it.
What are your thoughts? Are you or someone you know struggling with symptoms of ADHD? The best way to help the ACO spread its knowledge is by letting others know about us. I hope you share this podcast with your friends and family and let them know about our work. You can connect with us at orgonomy.org. I'm Dr. Chris Burritt. Thank you for listening to the Different Kind of Psychiatry podcast brought to you by the ACO. Since 1968, the psychiatrists affiliated with the American College of Orgonomy have been helping patients discover greater satisfaction, health, and overall well-being in their lives. Whether patients suffer with mental illness, struggle with addiction, or feel unsatisfied with their work lives or relationships, medical orgone therapy, as practiced by the physicians at the ACO, offers a way forward, often without the use of medication.